If outside contamination of the regulated waste container occurs, it must be placed in a second container meeting the above standards. If clothing becomes contaminated with potentially infectious pathogens, remove them in a manner that avoids contact with skin and mucous membranes. If necessary, cut the shirt to safely avoid contact with the body. If there's a chance your clothes could get contaminated, always bring an extra set of clothing. Do not bring contaminated clothes home to launder. Your employer is responsible for the cleaning. Contaminated laundry must be handled as little as possible with a minimum of agitation. It must be bagged or contained where used. It must be placed and transported in appropriate biohazard containers. If laundry is wet, it must be placed and transported in containers that prevent soak-through or leakage of fluids to the exterior. If an exposure does occur, immediately stop and wash your hands with soap and water. Flush mucous membranes. Report the incident to your supervisor immediately. Failure to report an incident may limit your ability to prove exposure or obtain appropriate medical treatment. Attempt to identify the source individual and collect any contaminated materials for testing purposes. Seek medical attention. If you have not had an HPV vaccine, it can be administered after an exposure. Employers should follow all federal and state requirements for recording and reporting occupational injuries and exposures. The employer is responsible for ensuring the confidentiality of your medical records. Your records cannot be disclosed without your written consent. The Exposure Control Plan is a guideline for employees that have had exposure to blood or OPIM and is required for each work area that has a potential exposure to blood or OPIM. Your Exposure Control Plan must be specific to your department, reviewed yearly, accessible to all employees. Non-managerial employees shall have input on the Exposure Control Plan. The information should be recorded in the exposed person's confidential medical record made available to qualified healthcare professionals and contain the following information: date and time of the exposure incident, location of the exposure incident, job classification of the employee exposed to BBP, identification and documentation of the source individual unless the identification is not feasible, the route and circumstances of exposure, details of the exposure including the type and amount of fluid or material and the severity of the exposure. Identify procedural changes that would prevent reoccurrence of any conditions that increase the risk of exposure. Document what engineer controls, work practice controls, and PPE that was used. If you are working in an area where there is reasonable likelihood of exposure, do not eat, drink, smoke, apply cosmetics or lip balm, handle contact lenses. Do not keep food or drink in refrigerators, freezers, shelves, cabinets, or on countertops where blood or potentially infectious materials are present. Sharps are defined as any object that can penetrate the skin. Pay 100% attention when handling sharps. Don't shear or break contaminated needles. Don't bend, recap, or remove contaminated needles or other contaminated sharps unless it can be demonstrated that there is no feasible alternative. If bending, recapping, or needle removal is necessary, it must be done using a mechanical device or a one-handed technique. Place contaminated reusable sharps in appropriate containers immediately. Needles should go directly from patient into sharps bin in one motion. Store or process contaminated reusable sharps so that staff members are not required to reach into the container or sink by hand. Ensure reusable sharps containers aren't opened, emptied, or cleaned manually, or in any other manner that would expose staff to contaminated sharps. Accidental sharps injuries in healthcare and other occupational settings continues to be a serious problem. Therefore, the Needle Stick Safety and Prevention Act was signed into law. The law set forth to strengthen OSHA's requirement for employers to identify, evaluate, and implement safer medical devices on an annual basis. involve non-managerial healthcare workers in the evaluation of such equipment, and the law requires employers to maintain a SHARPS injury log. The log must be recorded and maintained in a manner that protects the confidentiality of the injured employee and must contain the following: date of injury, type and brand of the device involved, where the incident occurred, how the incident occurred. Contaminated sharps are to be discarded immediately after use in sharps containers. Sharps containers need to be easily accessible to personnel, located as close to where sharps are used as feasible, maintained upright throughout use, replaced routinely and not allowed to overfill.